One of the other things that's really different about how we do it here is I just don't want like our nurse practitioners learning from other nurse practitioners. I want to train them in things that I think are important, and Dr. Traywick will be training them in things, not just specific techniques, but the theory, understanding where does the med spa fit in the scheme of dermatology, medical dermatology, skin conditions in general, so that they have that side. The knowledge on that side of the specialty. And from plastic surgery standpoint, I really want them to know the anatomy. I was taught that fear in plastic surgery, or fear in any surgery, is fear of anatomy. Well, I was just telling one of the mid-levels that I was training today, fear of injections is fear of anatomy. So I had her just yesterday in the operating room with me, observing a brow lift, and I'm showing her these are the muscles from the inside that you're injecting with Botox. These are the arteries and the nerves that they talk about in the book. This is exactly where they are. This is exactly how deep it is. This is the facial artery. And seeing all those things, it's a whole lot different than just having someone talk about it and look at a picture in a textbook